Welcome back to Bottom Line Africa, and now we're joined by Donald Opat, who's AMREF's program manager, Global Fund for Malaria, when it comes to the issues that have to do with malaria here in the country. And Donald, thank you for making time to join us here on Bottom Line Africa. We are talking about the fight against malaria, but then just kindly paint for us a picture. Within the African continent, and specifically Kenya, where are we at when it comes to the fight against malaria during this time of COVID-19 pandemic? Mr. Opat, kindly unmute your mic so that we can hear what you're saying.
Oh, sorry about that.
No problem. No problem. We can hear you now.
Yeah, thank you for that opportunity. Yes, and malaria itself is, I think, from the basic, is a life-threatening disease, and this is something that is known globally, and it affects basically every population at every population level, and of course, looking at the global picture. Where we are in the last few years, we have actually stagnated in terms of the progress towards basically having complete control and subsequent elimination of malaria. In Kenya, generally a bit of improvements. We had our Kenya Malaria Indicator Survey that was recently launched. And from some of the preliminary findings, we are starting to see that the prevalence of malaria actually is going down. For instance, in the two regions where we actually see a lot of malaria in Kenya, that is the Lake Endemic, which has the 8 counties of the former Western and Nyanza region, the prevalence of malaria actually has come down from around 28% to 19%. And again, if you look at the coastal area, we've seen a significant drop from around 8% to 4.5%. So generally, as a country, we are making a bit of improvements, but of course, we can still do better.
And you know, what you're telling us, if I heard you correctly, you say that generally within the African continent, the fight against malaria has been slow. What is making the fight against malaria to be very slow within the African continent?
So basically, when we look at malaria, the incidences and prevalences, we stratify, and the countries are at different trajectories in terms of actually maintaining having malaria under control. And of course, we know very well that around 90% of malaria cases occur in sub-Saharan Africa. And of course, within Africa, there are other countries which basically bear almost 50% of the disease. And this is especially a country like Nigeria, Uganda, DRC, Mozambique, and so forth. So these countries actually bear 50%. So it's basically the involvements at different levels, of course, interventions and the need to intervene based on the local political will, issues that have to do with surveillance, the investment case, the financing for malaria control will vary in each and every country. So what we do in Kenya will probably be different from what is happening in other countries. But again, that is a discussion that probably is key in terms of how we subsequently eliminate and eradicate malaria globally.
And you know, it's good you're saying there's hope for the fight against malaria. I mean, the numbers to go down, for the country to win, the war against malaria. But when I look at the Nyanza region, specifically Migori County, Mr. Opat, we're seeing the high cases where residents right there are not using the nets they're given for the right use. Some of them are using them for fishing. Others are using them, to make houses for their chickens. So how has what has AMREF really done to ensure that, residents there use the nets, the malaria mosquito nets for the right purpose?
Yeah, so for AMREF Health Africa, basically we use our expertise on community health system strengthening. That is our role. And for the obvious, AMREF Health Africa is an unstated principal recipient for the Global Fund against malaria. And what we do is working with the communities to ensure that interventions at those levels, because of course, if you're developing a strategy to actually control and subsequently eliminate malaria, then there needs to be that community participation. And that is what has actually helped other countries that have gone further to actually even eliminate malaria. So it's very critical to understand that, of course, we have those challenges, and that is why we're actually investing a lot of social behavior change, trying to change that human perception or perspective in terms of how the nets are supposed to be used. But these are economic reasons. So people see value in other things and actually prefer to use bed nets for other interventions. But again, that sustained investment to ensure that people are knowledgeable, people understand the impacts of malaria and how it actually contributes to deaths is what we really need to put on the table for most of these people to understand why these interventions are critical.
All right. And you know, the fight against COVID-19 globally has actually affected medical checkups for several patients, and definitely malaria has been affected. The patients who fear going to the hospital, fearing, you know, having the perception, quote unquote, that they might, you know, contract the virus within the hospital setup. Others are just afraid, you know, fear of unknown. So has this affected, you know, when it comes to access to healthcare within the country?
Yeah, initially when COVID came, of course, there was a bit of confusion in terms of how we are going to deal with it. And some of the restrictions was for people to actually stay indoors. And this also affected patients, people who had suspected malaria cases because of the common presentation of fever. So that was first an issue in terms of having people go to facilities to access those services. But subsequently, of course, with the processes that we underwent in the initial phase of containing COVID, where the stigma issues were actually raised at the community levels. So people were fearful of getting out to get tested. And every fever at that particular point, people felt like every fever was probably due to malaria, even for people who actually knew that probably they'll be suffering from malaria and not COVID. But this is where now the community interventions come in. And even from tracking the qualities and the service delivery over a point in time, we actually saw that there was a reduction in the number of cases of malaria that were actually being seen. The caseloads at facility levels actually went down. But now it became imperative for the communities to actually ensure that the community health volunteers who worked at level 1 were able to track these conditions but also give health promotions in terms of what was distinguishing between malaria and COVID. However, again, it became very difficult for us to actually sustain some of these interventions because of the PPE issues. Initially, lack of PPEs, most of them were ending at facility levels and not at community levels. But again, with the kind of financing we've received currently, there's communities that are a bit sustained in terms of ensuring that cases are actually managed and referred.
In fact, Mr. Opato, I was about to ask you that. It's good you've answered it because, you know, I was just thinking about how that has affected the fight against malaria here in the country. You know, fear of, if you say you have fever, then it will be related to some of the symptoms of COVID-19 in terms of PPEs, in terms of community health workers, how they were actually dealing with families within villages, you know, when it comes to fighting malaria in the country.
Yeah, so lack of information is very dangerous, and of course, even when COVID hit us, we were still trying to develop information so that we could disseminate it. And you can even see that with the vaccines, the bit of the vaccine hesitancy, and it had to target healthcare workers, but this was a targeted rollout because of the urgent need that needed to be out there. But even now, there's still a lot of hesitancy in terms of people still doubting what could actually be happening. But for malaria, again, most of the systems are now a bit stronger. The healthcare providers are a bit stronger. The systems are becoming more resilient to actually accommodating all the aspects. Previously, you could see most of the wards could have been occupied by patients who had COVID, as well as we know that malaria actually contributes to the significant deaths and high admission rates in some of these areas. So that community sensitizations, of course, again, what we're doing now as AMREF and working with the Division of National Malaria Program is to ensure that we actually, as we provide information around malaria, because we need to sustain that fight, but we also leverage on the existing challenges and also integrate this information with COVID.
And has it affected in terms of access to drugs, malaria drugs, COVID-19? Because that has been a major concern to some health workers and doctors, that COVID-19 has actually affected so many things, right from tablets for various patients and also various vaccines.
Yeah, true. Again, and again, at some point, yes, globally, there was a disruption in supply chain. Most of the commodities could not get because of the restrictions. Countries were closing down. The ports were not functional. And this, at some point, contributed to a significant amount of stockouts of commodities in Kenya. But again, like we are now normalizing and trying to understand the disease, and processes and investments are now being put in both areas, because at initial phase, again, there was fear that all the monies financing for malaria could probably move to COVID. But again, the malaria world has come out very strongly. And of course, we are raising issues because malaria actually still contributes to significant morbidity and mortality. And now we are seeing a sustained, the country currently is a bit well stocked, of course, from support from also other partners.
And so what do African countries need to do to completely phase out malaria within the African continent?
A lot of things, and I think that's the question. And of course, in Africa, there are 3 countries that have so far eliminated malaria. That's Mauritius, Morocco in 2010, and recently Algeria. And that's what probably you can relate to, Algeria in 2019. What did they actually do? And first was on political commitment. That needs to be up there. Of course, in Kenya, we currently very lucky to have President Uhuru Kenyatta actually leading the ALMA, and bringing all African leaders together towards that fight against malaria. 2 was on surveillance systems, improved strong surveillance systems which are able to quickly detect outbreaks of malaria and respond to them. 3 is capacity building of healthcare workers to actively manage malaria according to recommended guidelines. So, and then the use of primary healthcare strengthening, where we have patient-centered care at community levels, and actually they have that contributions in terms of how they want to be managed. So those are some of the things we borrow. Of course, there's the vaccine, which is currently being implemented in 3 countries in Africa, Kenya being one of them. We are closely looking at this to see what kind of impact it has in terms of reduction of mortality, especially in children. We know that the Global Technical Advisory Committee will be meeting sometimes late this year to give the recommendations for if there's need to scale up the implementation of the vaccine.
And you know, talking about the vaccine, I was about to ask you the same thing, Mr. Opat, because you know the biotech, BioNTech is actually starting work on the malaria vaccine in Africa. And you know, it comes also at a time when the WHO head, that is Tedros, said that this vaccine, the mRNA vaccine, prompts the human body to make protein that is part of the pathogen triggering an immune system. So how successful will this be, owing to the fact that the world's focus right now, scientists' focus, is on ensuring that countries have enough COVID-19 vaccines?
Yeah, I think the development of malaria vaccine is something that has been there even before we thought about COVID, and I think the progress towards ensuring that we have a vaccine on time is non-negotiable. And of course, as countries move towards containing COVID, we've not seen any halt in the processes of development of vaccine. And of course, having known that the first vaccine, the RTSS, that is currently being implemented in Kenya and Ghana and Malawi, has actually shown significant success in terms of reducing mortalities among children. But again, you also know that there's a second vaccine which is actually being worked on. I think it's on phase 2 or phase 3 trial, the R21, which is basically a modified form of the RTSS. So that just basically shows you that even within this short span, because the RTSS, the first vaccine, I think its rollout started in around 2019, and in a span of 2-3 years, now we have 2 vaccines that we are working on, and to me that is a greater success, especially looking from where we came from.
Is there hopes of this when it comes to the high efficacy, this vaccine working? Because I mean, years back, the world's first and only licensed malaria vaccine, that is Mosquirix, was developed by the GlaxoSmithKline, and it was only effective in a few African countries, and the efficacy was about 30%. So is there hope for this new vaccine for malaria that's supposed to be tested also in Africa, Kenya being one of the countries, African countries?
So yeah, there is hope. The RTSS actually will prevent 4 out of 10 cases of malaria for them to progress to severe disease. So that is already a progress. If you can actually save 4 out of 10 coming from 0, that's already a significant improvements over a period of 4 years. The R21, which is supposed to be effective at around 77%, that's actually protection around 8 out of 10, and that is hope. And once we see, of course, the implementation strategy that is currently happening is to guide the world and the WHO in terms of the safety and the efficacy in terms of actual controls and reductions in mortality. So that is what we are waiting for. Once it's rolled out, then I think it's easier for us to actually build, because this is a step forward. But again, if you look at countries that have eliminated malaria, it's not like they use the vaccine. Most of these countries did not actually eliminate malaria because of the vaccine, the other interventions. So, and normally what we say, there has to be an integrated approach towards eliminating malaria. First, you must target the vector itself, which is the mosquito. You must look at the parasite. You must handle the human behavior. And also, all these operates within an environment. So all these 4 components of malaria system must be targeted at a goal. Focusing on vector control alone and not focusing on environmental control basically doesn't add up much value, and then we have a kind of a prolonged trajectory in terms of eliminating malaria. And that is what we are doing in Kenya. Currently, there's already a conversation around elimination with multi-sectoral involvement. The country is in the process of developing a strategy for elimination. Good thing, again, as we also learn as we move forward, we have 4 counties in Kenya which has now in the elimination path, the Nyeri, Laikipia, I think the other 2 more. So actually, those are some of the lessons, because even if you have to eliminate malaria, now you have to actually start stratifying use of local data, use of information, intelligence, strengthened surveillance system to ensure that actually we are eliminating this disease.
But Mr. Pat, I like the way you put it forth when we began this conversation about malaria infecting so many people, millions of people, but it kills more than 400,000, most of them babies and young girls in the poorest parts of Africa. So why are young children dying out of malaria compared, the mortality rate compared to adults?
Yeah, it's all about the immune response. So children, especially under 5, are at risk of malaria because of their immune response. The bodies have still not developed that immune response that is actually able to fight malaria. And this also happens among pregnant women because of the physiological changes that actually occur during pregnancy. And that is why these interventions are actually targeting the vulnerable population at this particular point in time. But as age tends to increase, then the body tends to respond better. There's some level of immunity that can be able to protect you if you get an infective bite. And so that is how actually we tailor our innovations and research and development so that actually the targeted groups are actually catered for.
So then who is failing who when it comes to the fight against malaria? Is it the people, or is it the African government administrations when it comes to laxity in the fight?
That's a very good question. I think this is a fight where everyone needs to be involved. Of course, human behavior becomes very critical in malaria elimination, because if you look at the current interventions that are there, the use of ITNs or LLINs, the indoor residual sprays, most of these interventions, and actually even case management, the ability to seek treatment, they're all dependent on human behavior, which means that if I, Dr. Pat, I'm not comfortable with use of a bed nets, then I will not use it. So most of them are dependent on human behavior. Now, there are a lot of research that is going out there, and not even vaccine itself, where you can even have what we call the sterile mosquitoes, which are basically can be developed in a lab, and then they're just let out to go and mate with other mosquitoes, so that the offsprings that come out are not able to transmit. So those are strategies that will be used without involving the human, so that we are not able to make our decisions. Those are some things that are still being worked on behind the curtains. But again, human behavior has to change. We have to accept. And if you look at countries that are actually eliminating malaria, it's a simple understanding that if you go to a particular area, please, you need to sleep under net. If you're not going to sleep under net, you're going to get an infective bite. It's as simple as such. But the fact that people do not practice is one particular area that maybe we as scientists, we need to dig deep, understand what are the social, cultural barriers to some of the use of some of these interventions. And they actually play a role. As the Kenya Malaria Indicator Survey will be out, the full report will be out. And this was actually a survey which was conducted based on different dynamics in terms of education levels, residents, and so forth, gender, and all that. Then you start to realize that there's a clear difference in terms of how people perceive some of these interventions, and we need to break those barriers.
On that note, let me say asante sana. Donald Apat is the program manager, Global Fund Malaria at AMREF, just talking to us about how the country is fighting malaria in the country, saying, I mean, it's good news because counties like Migori and the Western region were actually regions that are reporting high cases of malaria, but the numbers are going down. Opat, if I got you right, that's what you said.
Correct.
All right. Thank you so much for joining us here on Bottom Line Africa. Always a pleasure having you. Talk to us about issues to do with health, malaria in the country. Now, and finally, Ethiopia's Prime Minister's office released drone footage of the Grand Ethiopian Dam on social media this week, showing the